Hello, folks. Join our community and stay up to date all the time with the ESTES podcast series. This activity is sponsored by the ESTES Education Committee. Stay with us. Stay with ESTES.
Welcome, folks. Today we are discussing a narrative review on the evolving role of helical plating in orthopedic trauma surgery. Helical plating, a technique using plates that wrap around the bone, offers a potentially safer and more effective alternative to traditional straight plates in certain fracture types.
That sounds interesting. What are the main advantages of using helical plates compared to traditional straight plates?
Well, the primary advantage seems to be improved neurovascular safety. In areas like the humerus, where the radial nerve is vulnerable, helical plates can reduce the risk of nerve damage during surgery. They also offer superior torsional resistance, particularly in femoral fractures. The review highlights that the optimal helical plate design varies depending on the bone and patient factors. For example, 45-degree helical plates are recommended for minimally invasive humeral plating, while 180-degree plates might be better suited for young patients with femoral fractures.
So, the angle of the helix is crucial? What about the evidence supporting these claims? What kind of studies were reviewed?
Absolutely. The review included a variety of study types: simulation studies using finite element analysis, FEA, biomechanical studies, clinical case series, comparative studies, and anatomical studies. Most studies focused on the femur and humerus. Interestingly, there were no randomized controlled trials, which is a limitation the authors acknowledge. The studies showed that helical plates offer comparable stability to straight plates, but with those key advantages in certain situations. The FEA studies, for instance, showed that helical plates can lead to slightly deferred bone healing due to larger shear movements, but this is balanced by the reduced stiffness and lower neurovascular risks.
I see. Interesting. But if there's deferred bone healing, isn't that a significant drawback? Doesn't that outweigh the benefits in some cases?
That's a valid point. The review does mention that higher torsional and shear movements at the fracture gap were detected in some FEA studies, which could potentially influence healing. However, the authors emphasize that the clinical benefits, such as reduced nerve damage and improved load distribution, might still outweigh this potential drawback, especially in specific patient populations and fracture types. It's a complex trade-off that needs further investigation.
What about the different types of helical plates? The review mentions 45-degree, 90-degree, and 180-degree angles. Are there specific situations where one is preferred over the others?
Yes, the angle of the helix is critical. 45-degree helical plates seem particularly well-suited for minimally invasive plate osteosynthesis, MIPO, of the humerus because they can be inserted through a smaller incision, minimizing tissue disruption. 90-degree helical plates are suggested for use in geriatric patients with femoral fractures, often as part of a double plating construct to enhance stability. And 180-degree helical plates appear to be a good option for young patients with femoral fractures, offering superior axial stability. But again, more research is needed to solidify these recommendations.
The review also mentions double plating. Can you elaborate on that?
Sure. Double plating involves using two plates to fix a fracture, which can improve stability, especially in challenging cases. The review suggests that a 90-degree helical plate, used in conjunction with a straight plate, can be particularly beneficial in geriatric patients with distal femoral fractures. This combination seems to offer better damping during axial loading and avoids potential damage to the medial neurovascular structures.
So, what are the main conclusions of this review? What are the next steps in research?
The review concludes that helical plates offer a viable alternative to straight plates, especially when neurovascular structures are at risk. However, it emphasizes the need for further high-quality research, including randomized controlled trials, to establish definitive clinical guidelines. Specifically, more research is needed on the biomechanical properties of different helical plate designs, particularly in osteoporotic bone, and on the long-term clinical outcomes. Also, the authors highlight the need for research on the ALPS plate, a specific type of helical plate, and the potential benefits of 3D printed helical plates.
It sounds like there's still much to learn about helical plating. Thanks for summarizing this important review.
You're welcome. It's a fascinating area of ongoing research with the potential to significantly improve fracture care. Thanks for listening, folks, and we'll catch you next time.